I'd like to call the meeting to order and indicate an opportunity for any member with conflict of interest to so indicate. Seeing none, I'll proceed. And Dr. Nettles, would you be willing to go over the mission statement?
I will, thank you. To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into practice.
Thank you, Dr. Nettles. And then any public comment?
No, sir, there are none.
Okay. So we'll have someone review the minutes from the July 31st meeting and have corrections or a motion to approve. If there are no.
So moved.
All in favor, say aye.
We need a second.
Okay. Any second? All in favor, say aye. Any opposed? Any questions? Okay. And we have 4 contracts to review today for approval. The first one is the acquis for air handler unit refurbishment. Do you like to give us a summary of that one, Dr. Miller?
Thank you, Chair. We will have Jerry Galloon that will share.
Good. All right, so good afternoon. First, I just want to thank the board and Dr. Elders for championing all the infrastructure changes that are truly needed. So this first project is to refurbish the components of the air handler system. There's 12 units. This will provide us approximately 5 to 7 years additional life. They are past life right now. We went out to bid and came back with a acquis, which I do have experience with in New York City, doing the same type of projects. So I would take any questions if anybody has any.
Any questions? Sure.
Thank you, Dr. Inzeray. I do want to add that this is part, so on the previous interim CEO report, we had a list of urgent capital needs. This is a portion of that. So Jerry will be presenting 2 of those. We did have to take them back out to bid because they were past the 30-day timeline, but these are the needs that were reported, and we were able to secure funding with the help of our board chair. And so that's all I really wanted to add.
Thank you.
Thank you.
Any questions? Thank you.
Thank you.
The second contract is the Agility Health for mattress replacement.
Sir,
Okay, we get a motion to approve the first one.
second.
All in favor, say aye.
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 So moved. And the second one is Agility Health for mattress replacement. And my understanding is this is to replace some of the mattresses in the patient areas that are really.
Yes, sir.
Do you want to give some more detail?
All right, so this was identified through an audit, which we identified that there were serious problems with the mattresses. They are 7 to 10 years old, which is significantly longer than what is the industry standard for their lifespan. We put them out to bid also, and it's for 144 mattresses, stretchers, OR, all the surfaces in the building, because they are all excessively old.
Okay. We get a motion to approve.
Question.
Okay.
What's the normal life cycle of mattresses?
4 to 6 years, 4 to 7 years. It depends on the quality of the mattress.
Is this 100% of the mattresses?
Yes, sir.
Any other questions? We get a motion to approve?
Second.
Second. All in favor, say aye.
Aye.
Okay.
Okay, thank you.
And then the third contract is dealing with perioperative services. Dr. Joshua Baxter, give us some more information.
Good afternoon, Mr. Chair and board members. This is a contract for a service agreement between Getting a USA and Nashville General Hospital. This contract will establish an agreement to provide preventative maintenance and service to support our equipment sterilizers that were placed 18 months ago. This is an ongoing agreement to provide us with on-site service, telehealth, and to prevent services from monthly charges. This will be a 3-year agreement.
Any questions? I get a motion to approve. A second.
Second.
All in favor, say aye. Aye. Okay. And then the last one is a collection company for diagnostic imaging.
Hey, good afternoon. I'm Tim Farmer, the Director of Radiology. I'm seeking approval for the GLA collection contract. This is for Nashville Healthcare Diagnostic Imaging. We did send this out for an RFP. We received back one due to the anticipated low amounts in accounts receivable. This is a no cost to the facility other than we don't want to leave things in accounts receivable. We do split the collections 30-70. 30% to the collection company, 70% back to the facility. We do take self-pay patients at the imaging center. And while we do ask for a significant portion on the front end, there is a portion left over on the back end. This will prevent that and give us an avenue to pursue that. Anything over $25, we can alter that down or up as we see fit. And anything in accounts receivable over 121 days. This is a 1-year agreement, renewable, with a 90-day out.
May I ask a question about, I know it's at no cost, it's a percentage of the recovery, but there are some cost estimates here. What do these costs represent?
So the cost estimate that's on your agenda is a misprint.
Okay.
In order for us to have over $100,000, I got to be sitting at $350,000 in accounts receivable. If I'm sitting at $350,000 in accounts receivable, I got problems. So there is no estimated cost to it.
I didn't know if that was a function of how much AR there is. It sounds like the AR is very little. The other question I have is a reputational question, which is there's been a lot of attention in recent years to hospitals and healthcare providers going into collections, the problem of medical debt. So I'm aware that when the hospital engages a debt collection firm, it's the hospital's AR that's at issue and the hospital's reputation is at issue. Can you just tell us about the guidelines or the things that are in place to ensure that a reasonable effort is made to collect these, but that our collector is working with the idea of the overall mission and tenor of the hospital and our role in the community?
Sure. So the billing company for the imaging center will send 3 notifications, 30, 90, 30, 60, and 90. And then on the last 120, we'll notify the patient at that point that the account will go to collections. Prior to that account moving to collections, they have to have a yay or nay from the facility side. So we still have an opportunity at that point to pull back if need be. And again, given that we're the imaging center, it is a low amount. We're not talking thousands of dollars. We're, $100 here, $150 there. But we do have the ability with GLA to kind of curtail that a little bit and say, let's pull this one back, let's move forward here. But we will give them forward notices prior to moving to collections.
Great, thank you. Appreciate that information.
Any other questions? Okay, could we get a motion to approve?
Motion to approve.
Any second? All in favor, say aye. Aye. Thank you. And we go to FY25 audit. Dr. Blackledge.
Good afternoon, Chair. Good afternoon, board members. As I share this update on our FY25 audit, I'll start with sharing that our team has been meeting with Crossland, the Crossland firm. Those are our auditors annually. We've had about 3 or 4 meetings just to organize ourselves and begin to discuss what this looks like, what it feels like for us as an organization this year. I will additionally share that I've had a one-on-one discussion at a very high level with the Crossland auditors as they began to prepare. And my discussion was really around some of the changes that we've made within the accounting finance arena as it relates to our KPMG projects. So had a very high level discussion with them, began to talk about what does it look like and offering for their attendance on site for us for some room face-to-face conversations. So we began to have that discussion and they all seem to be going pretty well right now. What our team is doing, our team is actually working to gather and assemble probably 90 different, more than 90, but 90 different requests for documentation. So documentation that supports our policies, the things that we do within finance and in other areas of the hospital, providing that documentation, we have to upload that to a private ShareLink site. We will have a soft kickoff tomorrow morning at 9 o'clock. So we're starting, and then in September, the first week, we'll have another hard kickoff. And our intent is to be complete with our audit probably mid-October to the end of October. But right now it's early. Preliminary discussions have been held. They all have been positive right now. And I'll take any questions as it relates to the audit.
Hearing none, we'll proceed to the KPMG update.
Sure, we have members represented from KPMG. I will ask them to come to the podium. And please introduce yourselves again. I know that you presented, I believe it was back in May or June.
Good afternoon. Thank you for having us. Good afternoon. Thank you for having us. My name's Hillary Simic. I'm a partner with KPMG, and I have Chris Dixon, who's a director on our team with me today as well. So as Dr. Blackledge mentioned, we wanted to give you an update on our project, which is coming to a close this month. The focus really on improving the financial reporting process and creating sustainable practices within the accounting and finance department. Do you have the slides? No, perfect. You can go to the second one. So we're revisiting the timeline that was presented before, really kicking off in May and really gaining an understanding of what the current process and practices look like. During that time, what we found was that prior practices, historical policies, just weren't up to industry standards that we would have expected. So we started identifying improvements, implementing those improvements. Through August, we kept doing that, really focused on year end and implementing the process improvements and finalizing our roadmap. From here forward, we're really we've transferred everything over to the team, and now they're working to stabilize process improvements as well as identify new ones that will continue to be an iterative process going forward. As part of our commitment in this project, we promised to deliver certain documents and tools. So we have several policies and several SOPs or procedures that really make a sustainable practice or consistent practice for people to follow. In addition, working alongside the NHG team, we either revamped or created new reconciliations and tools that really validate the financial data and put more control around that data. We know we've had new team members join NGH, and through all of this, we've seen a lot more communication and collaboration between the parties. So through all of this, really it's building that strong foundation for the team to have a more sustainable financial reporting process and really give the leadership team better, reliable data to make decisions based off of. And I'll turn it over to Chris to go through some of the specific improvements that we've implemented.
Hello, everyone. My name's Chris Dixon. I'm a director at KPMG in our accounting advisory practice, specializing in healthcare companies, and happy to be back with you again today after, I guess, 2 months is the last time we chatted. So, revisiting a slide that we looked at last time. Up at the top last time, I think it said systems and difficulties, and I alluded to the fact that we were trying from an accounting perspective to take a bit of a medical approach. We were looking at what the symptoms of the underlying problems were, and we were going to go about it and propose some solutions or prescribe some medication, if you will. When you look at this, and I don't think you can see the slide that clearly, but I'll talk to what's up here. There are a few items to tell a bit of a story that we've noted when we started that were symptomatic of larger problems. Some of them, to start, were with payables and really invoices. There were processes that were, I would say, disjointed and under some of the previous administration were just a bit broken, and it was resulting in a pileup of invoices that needed to be processed and needed to be essentially accrued for at the end of a period. What we did is we said the underlying problem there is it needs to be simplified. Communication amongst stakeholders within the finance and accounting department needs to be better. And ultimately, there needs to be some kind of tool that helps the department calculate these. So that's what we set out to do, and ultimately one of the main outputs was a tool that we worked with the accounting department to try to better understand for some of the large vendors and the main vendors what's outstanding and how to get that paid down. And what's the story here? The story is, well, if you go back to February, the payables and invoices were sitting at around $27 million. And you fast forward to when we started on the project and that first month, and they're around $20 million. And now they're down to $13 million. So things are functioning more effectively and efficiently as this goes on. And what I'll say about all of these items that I'll highlight here, and going back to my kind of cajoling of how we're mimicking the medical profession, sometimes medicine takes a little while to get to full efficacy. At the end of the day, these processes are just being instilled. They're still being absorbed and stabilized, really, by the department, but we're seeing the effects, and that's what's exciting here. Another one I'll highlight up here is patient revenue and AR, accounts receivable. This one was particularly exciting because before KPMG came here, one of the first items we noted with patient revenue and AR is there wasn't a standardized system. In fact, there really wasn't a system for creating and calculating what bad debts would be at the end of each month and what payer contractual adjustments would be, which basically are a reduction of revenue. And we put in place a tool that's used really across a lot of hospitals here in the US to help with that calculation. And that's currently being used and now settled into a process that's going to be used month over month going forward. That's going to help with that calculation. That's going to de-risk this a lot and make things a bit simpler going forward from a revenue perspective, and hopefully get data in these meetings quicker. One or two other items I'll highlight at a high level without belaboring some of the points is another process that we noted is when we originally set out and had some interviews, it became clear that, and I'll be a little bit of an accounting geek here, but accrual accounting wasn't really being followed here. It was more a cash basis, and things were piling up and waiting month over month to be done. And then at year end, all of the reconciliations, all of the actual data processing was happening for major accounts like leases and property. So what we've tried to do is assemble both tools and reconciliations that can be done on a monthly basis. Not only will that keep the books and records up to date, but it'll give better decision-making data to the board, the committees, the folks who are using the data, which was quite exciting. And I know last time we were here, we mentioned that there was observations around payroll and HR. We also instilled some checklists and processes there that'll help bridge communication between both the payroll and the finance department to ensure that there is not only better communication, but less risk in either changes or personnel, when personnel are terminated, that things are being updated and reflected timely. So all in, when we look at this slide and recap the story here, and maybe it's best told through the next slide, is that we looked at 90 different areas in total and proposed improvements across those. And while those are just a few of the stories, there's 80 others similar to that, where we've observed things, we've proposed differences, and we've tried to work really proactively with the team to put in place a roadmap that can be used going forward and reduce a lot of the risk that we've seen in the prior months and then in the prior year's audit. So I'll pause here before I move to a final slide that summarizes some of this and just make sure that resonates and see if there are any questions or comments there. Okay. Well, on the final slide, I want to read this quote because I don't know if everyone can see it, but I think it's really important from our perspective at KPMG as a commentary of where we believe Nashville General Hospital is at this point in time. And what it says is, over the course of the last 3 months, Nashville General Hospital embraced process improvements, both those recommended by KPMG and those that were developed and observed internally. These processes have enhanced transparency and consistency in internal communication, and these improvements, coupled with new leadership and a collaborative tone at the top, have strengthened the hospital's ability to produce more accurate financial information, supported by improving record keeping as well. And as a result, the hospital, we believe, is well positioned going into their fiscal year audit this year to have a more timely and a more accurate audit. So that's really where we leave off at the end of this month. And on a personal note, I guess what I'd say is I saw when I've come in here and we've traveled here, some of the signs outside that say a beacon of care and compassion. That's how we were treated the whole time we were here. And in fact, at the end, we got this wonderful card presented to us today by the Finance and Accounting Department. It's really been a great teaming effort. We've made friends along the way, and thank you for having us. We do hope that these processes resonate and help. Thank you.
Thank you. Thank you. All right.
Mr. Chairman, I just offer a comment on that.
Sure.
I really appreciate that presentation and KPMG's work, and it resonates with me because when I joined the board in October, I had a lot of questions, and there were parts of the hospital's financial operations that were real challenges to me. And it is so wonderful, and I want to commend Dr. Blackledge, the finance team, particularly the report on accounts payable. Seems like an unbelievable turnaround of the ship. And I know KPMG has been valuable, and appreciate hearing that hospital finance team has embraced that and utilized that, but also, credit where credit is due, that the hospital's executive leadership has shown remarkable efforts here, and want to just stop and recognize what a tremendous job they've done.
And I just want to add to that I really, really am impressed and appreciate the enhanced transparency and consistency. That is really key, because I think that lays the groundwork for the future work, the present and future work that we're doing. And so kudos to all of you.
Thank you. And Dr. Blackledge, you're going to give us the financial statements review.
Thank you for your comments. I'm going to pass it to Ray Mercado, our controller. But I have to be honest, when we started on this quest, the stories were very different. And I have to say, without getting emotional, because this was quite a journey from the beginning, but at the beginning, there was a lot of resistance. And without talking about that resistance and speaking, and I see someone shaking their head over there, but there was a lot of resistance. And today there was an email that said, I can't remember it word from word, but it was from one of the employees that said, wow, we've had, and I jokingly call it 99 improvements and you can't make it up. That's my storyline to it. But there was a tiramisu dessert or something that one of the employees made and said, along the way with all these improvements, we've made friends. And for me, I have to say, that's what my personal life is about, and that's what my professional life is about. And I'm just proud to be part of this team. I'm proud to be part of this executive leadership team, and it means a lot to me. With that, I'm going to turn it over to Ray before I say anything else. And he's going to talk about July.
Hi, everyone. Yeah, I have to say something, too, about KPMG and the time that we've had with them and how meaningful it is for the staff and to kind of welcome them in and embrace, you know, all the efforts and policies, procedures, just their approach, professional but warm and friendly, and it made everybody kind of circle the wagons and kind of really dive in and make the most of this. Because we know, I mean, we talked about it as a staff. This was not a very inexpensive option for Metro to invest in this hospital. So it means a lot, and it means a lot how they performed. So thank you guys. So just a brief overview, just that, you know, as we go forward with financial presentation, and I'll be brief, but you know, our goal is to have timely and accurate financials. That's what a finance team does. And one of the things that I've talked about for the last couple of months has been a culture of discipline. And we're in the process of instilling that in the finance team and making sure we have the right people on the bus. Those are two things I talked about a couple of months ago, and that's what we are doing. And we'll see improvements this month and going forward. But that is, I think Dr. Blackledge said, when I was concerned about certain things and I wish this was that or we could do this, and she said, was it better than last month? And so if we can answer that every month, then we're going to get to some really high levels. Okay, financials. The first in the financials, we've got some key indicators in the statistics tab. Just some things to point out as indicators of performance. On the first line of the admissions, again, the left and the right side are the same. This is the first month of our fiscal year. The admissions at 247 on a budget of 240, which is 202 from prior year. So it's a positive indicator there. If you slide down towards the middle under emergency visits, those are slightly down, 2,204 on a budget of 2,358. And then compared to last year of 2,464. And then clinic visits, a couple of lines down, 4,919 on a budget of 4,656. And then looking at surgery, inpatient and outpatient cases, inpatient 35 on a budget of 39, which is down from last year, 47. Outpatient cases at 125 on a budget of 104. And then cardiac cath lab, 25 on a budget of 23, down from last year at 46. And I know Dr. Blackledge and Dr. Elders are going to cover some specific opportunities there here shortly. On the next page, we have the income statement. And again, the left and the right side are the same. I'm just going to point out a few items, and then we'll open it up for any questions. Let's start by going all the way down to the bottom there towards where you see net income. You see net income of $7,891,000 on a budget of $217,000, which is great. But there's a primary driver of that. If you kind of slide back up towards the top in the income section, the other revenue section, you see $11,200,000 262 on a budget of 1,791,000. This is some funding, additional funding that we received that is unbudgeted from Metro that we received in the month of July. So those funds, incidentally, are going to be primarily focused on the payables that we talked about, continuing to drive that number down. And so that number is the primary factor there in being so over budget. So we welcome that. We didn't have it budgeted last year, or we didn't receive it last year, so we didn't budget it this year, and then we received it. So that's why it was unbudgeted. And then a couple of other factors, and I'm sorry to jump around a little bit, but under net patient revenue, just above that section, we've got $4,626,000 on a budget of $5,007,000, so a little over $1 million under budget. Really, this is primarily due to our first attempt with the new methodology that KPMG, that Hillary and Chris talked about. So we expect that to get better and tighter, more accurate as we go forward. It is accurate, but it's not as precise as we'd like to be, which is what we need with our revenue. So, but the way we were doing it again wasn't up to industry standards, and so we're converting over to something that is. The second item, just below that, under the city subsidy, you can see it's $6,062,000 on a budget of $5,062,000. That's $1 million over budget, which is great. But that has to do with the Metro funding of the KPMG project. So that $1 million, there's corresponding expense down in the expense section under contract services. So we had the $1 million come in, $1 million go out with expenses. So there's a net zero impact on the P&L. And then the third item is pharmacy. You can see pharmacy $1,143,000 on a budget of $699. So that is primarily due to additional efforts in pharmacy, the specialty pharmacy, acquiring specialty drugs that is part of a growth strategy there, which we should see some corresponding revenue there offset that. So that growth is happening, more than double and tripling some of their purchases recently. So that's what's going on there. And then finally, a couple lines down in leases and utilities, $882,000 over budget. That has to do with some of the efforts with KPMG. We had approximately 10 leases that were not properly accounted for. And so this is a true up of getting them, again, to industry standards. And so we had some higher than normal expenses related to that. So that's all I have on the income statement. And the next page on the balance sheet, just a couple of items here I wanted to point out. We talked before, I guess about middle of the page down, you can see accounts payable, $16,512,000 down from $17.3 last month. That's, of course, a direct effort of trying to get our payables under control. That is still probably the largest task we face as a team, is getting all that going forward. So that's going to continue to get better, and it already has gotten better over the last several months. So, and then the couple line items down from that, the deferred subsidy income, $23 million, up from 2.7 last month. That's two factors. That's one, the funds that we received, the funding, the $11 million unbudgeted, plus we received an advance on our subsidy that's supposed to last us through October. So those two go into deferred, and then we reclass them out of there into regular revenue for revenue recognition. And so that's all I have. Is there any questions?
Yes.
Yeah.
I'm going back to this first page, and you were mentioning some of the statistics, and I was looking at the variances on a lot of these. Emergency room admissions was up significantly, but I also looked down here at deliveries. At 87.5%, you essentially almost doubled the amount of deliveries that were had year over year. Has there been any focus on this area?
That's a great notice. I know every time, a delivery happens in the hospital, we hear the bell. That is such a sweet thing they do here. Any insight on that, the whys?
Yeah, I'm happy to talk about that. And so NGH does have a women's health arm of the OBGYN program, as well as Meharry Medical College. We do have 2 midwives that do assist with deliveries, and you can see we had a very, and it's not a very busy month, but it's still a busy month for us. And so we do see that service line growing, and there's a renewed focus and partnership with our, between Meharry and Nashville General in the OB program under the leadership of Dr. Bullock. It's my understanding also that Meharry has hired a new OB chair that will be starting soon, and we'll be looking at our OB chief position. So a lot of growth and work and focus going on in that area. Thank you.
Question.
Yeah.
Is
Sir.
there possibility that new person over at Meharry could do a dual job with the chief position here at the hospital?
Absolutely. And so when you look, and it'll be later on, part of our professional services agreement identifies those specific chief positions that the chair of Meharry Medical College are eligible to be. And OB is one of them. Yes, sir.
Any other questions? Thank you very much. And Dr. Blackledge, you're going to give the revenue cycle.
Sure. Thank you, Chair. As we look at the revenue cycle, when we think about the cash performance month over month, this is a trend of 13 months. With our focus on July cash performance posted about $4.5 million. It's important to note that typically there's a check received from one of the service providers that we provide care for, Centurion, and we had 3 of the 5 checks, 3 of those checks were not received. And that impact to the cash was $841,000. Now, it's important to note that that cash has been received. It was actually received on 8/1, like the first working day in August. So you'll see that cash come through. And right now, I know for August, they're at 5.2 million, I believe that is today. So to account for that cash. And we like to see trends that don't ebb and flow. We like to see a continuous trend. And for us, we like to see a continuous, steadily climbing, incremental progress trend. But if you look at the tiered bar, there is a slight incline going all the way through. But that was the issue for the month of July. And I can tell you that there was some disappointment in the team. They worked hard to collect the dollars and to not see it show up in the bank timely. And that was as a result of that service provider changing their EFT payment process to us. So it wasn't that they intentionally delayed. There was a lot of back and forth to ensure that we could get that right with our treasury and with their treasury team. If we move on to the unbilled is slightly up. So there has been a great focus on the aged accounts and bringing those back through where they're requiring edits. Some of those are related to unbilled services, unbundled services. So whether we should submit the claim unbundled or bundled for the service recognition. So the teams are focused on that, and they continue to stay focused on that piece of our business. That's an important piece. If I move on to the next slide, denials management. Denials, I'll back into denials. I always say there are 2 things that keep me up at night, and one is tariffs, the other one is the utilization of artificial intelligence. Not our utilization of it, but others outside of us that we work with, their utilization of AI and how it impacts our organization. And this is one of those areas. But for us here, we experienced during the month of July some issues around 2 midnight rules. So a lot of education, a lot of how do we remediate this issue. So our teams have been focused on that. We've gotten better at it, but we did have that 1 month where there was just a third of the dollars were tied up in 2 midnight rule cases. And,
I'm sorry, could you explain that a little? Is this a government payer? Is this
Yes.
Medicare, Medicaid?
Yeah, this is Medicare.
Okay.
So we have to make some decisions, like a patient comes in and they're in an observation status or what have you. You've got basically 2 midnights is the way the rule works. And so you have to make sure the diagnostic testing, what was ordered, we're nudging the providers. You're doing all that to either A, admit the patient, or B, discharge them to home or to what have you. Yeah, absolutely. And rules change for us every day. But we have 1,000 rules. We have to make sure that we're able to block and tackle all of the rules from the insurance provider so that we can get paid for those claims. Now, this is a denial, which is a delay because we are able to overturn those and receive payment, but it delays us getting those dollars. One of the things that we focused on since I've been here has been cash acceleration and net revenue improvement. So obviously, to our point, we want to accelerate the ability to have those dollars in the bank. Yeah. And we can see what our teams are trying to do, but that gives us the span to do all the other things that we need to do timely. Yeah. Any questions?
Any questions? Okay. I get a motion to adjourn. Okay. So, you get a motion to approve the financial report.
Oh, well, I move to adjourn then.
Yeah, that's it.
Yeah.
You have a hard job.
So, make sure I understand it. So it is the whole